taking care of your hair is part of self-care, it's part of self-love. And I preach that on my YouTube channel. Like I really talk about hair loss, hair transplant on my YouTube channel. I talk about what other hair transplant clinics won't even tell you, like the secrets about hair transplant, what you can do, the little tricks and tips. This is all just to help someone realize that it's not that bad. I can do it. I can take care of myself, and this is what I need to do to take care of myself. So I think beauty is basically self-love and self-care.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Nancy Echefu, a highly respected hair transplant physician and hair loss coach based in Peachtree City, Georgia, dedicated to helping men and women regain confidence through personalized and compassionate care. Since opening Havala Hair Restoration 2023, she has earned numerous recognitions, including 2024 regional winner of Best of Georgia, Best in Georgia Magazine 2025, and features in Voyage Atlanta and Women's Insider. She's the host of the 2024 Hair Exhibition Show, fellowship trained in aesthetic medicine, the only female hair transplant surgeon in South Georgia, and a proud ISHRS member and patient safety ambassador. Dr. Echefu continues to lead with innovation, ethics, and excellence in the field of hair restoration. So, Dr. Echefu, welcome and glad to have you here.
Thank you. Thank you so much. That was a good introduction.
Yeah, so let's start off with this. How did you first get interested in the medical field?
A medical field. I went to medical school. I think right from my childhood, I've always been interested in the medical field. Like I love taking care of people. I was just a passionate kid. I just wanted to help someone. If you're complaining of a headache, I was like, okay, what can I give to this person to help them relieve the headache? So that was just me. So it was natural for me. And my dad also kind of pushed me a little bit. I was like, initially I wanted to be a nurse. He said, okay, I told him I want to be a nurse because I love how they took care of people. I love the bedside nurse. I love that. Then my dad said, nurses take care of, 10 people. Doctors can take care of also 10 people and 15 people. I was like, okay, let me just be a doctor. I think, let me just be a doctor. I think I will kind of place the two side by side. I'm like, I'll just go be a doctor. That's been when I was a kid. I was like, I'll just be a doctor then. That's really all that happened. So it was just in my nature to care for people. So it was then my dad that put it in me like, hey, nurses care for people, doctors care for people, So, and I just went through the route of being a doctor. That's just all.
Okay. And so what was it, I guess, how did you decide to make that transition into hair restoration then, from when you decided to be a doctor?
I think what happens to people in life is that sometimes your journey will lead you somewhere else. I didn't have anything in hair restoration, but I had issues with my hair loss. So I dealt with hair loss for a long time. Now, before I went into hair restoration, I used to work as an emergency doctor, emergency physician. And when you work as an emergency physician, you're always on the go. Like you wake up in the morning or when you time for your shift. I didn't just have time to do anything. Like I had a personal braider that comes to my house. I go to a house to braid so I was always changing my hairstyles every 2 weeks. Like literally, my friends will tell you, if you're looking for Dr. Che, if you look for her based on her hairstyle, she's the lady that has different hairstyles. You cannot find her. If you see her today, I promise you she's not the same person tomorrow, you see? So, but I was doing that just to look good, keep up with appearances, but also that was damaging my hair. Okay? So when I realized, hey, I didn't like what I was looking at in the mirror. Like, when you come back home, and take off all the makeup and all the wigs and all that. I didn't like how my hair was looking. So I sought for help. But the problem with seeking for help is that most of the hair transplant surgeons is a male-dominated field, sorry to say. So they don't really know how to treat coming from a female aspect. They know how to do the hair transplant, but they don't know how to counsel. they can tell you you cannot put on the wigs, you cannot do the braids. But if you tell a female client that, what is the other option? What do you have?
Mm,
So that was my problem. So
mhm,
it was like I wasn't complete.
mm.
So I had to basically figure out things out, took care of my hair loss, found out different options for my female clients. So I'm not just a clinic you come to and I give you one option. No, I'm a clinic that will come and say, hey, this doesn't work for you. We can go this route. So that's the difference between Havila Hair Restoration and other clinics. And I also tell my clients, this is a one-stop shop.
And is that what prompted you to want to set up your own practice to be able to help
Yes,
solve this
yes, being
issue?
able to help solve this issue,
Mhm.
especially for men and women.
Mm, okay.
Yeah.
Now, when it comes to hair loss, I think that there's a lot of people that experience hair loss, that suffer from hair loss. As far as you know, is hair loss something that is largely genetic? Is it more environmental? Is it a mix of the two? Like, kind of what leads to hair loss?
No, I have a chart
Mhm,
on my website or
mhm.
on my Instagram. There's so many causes. There are 200 causes of hair loss. And
Wow.
each time people walk into your office, they might walk into your office dealing with hair loss from genetics. But
Mhm,
tomorrow they might walk in and they are stressed out. And that can also be part of the reason why they're dealing with hair loss. So
mhm,
everything, it depends per time. So
mhm.
mostly it's genetic, but there are other factors. Let's say somebody is trying to lose weight. There is also stress. There's also a shift in your cycle with hair growth. So even if so you can have different causes of hair loss happening to someone at the same time.
Okay.
Okay. So
Yeah.
even if you say genetic, that person might also be under heavy stress.
Okay.
So that is why hair loss is not something you can just say, this is what's happening, because that might not be at that time you're seeing the client.
I see. Okay. So when you have a client or a patient come into your practice, are you trying to figure out what the root is for the hair loss? Like, is it genetics? Is it stress? Is it this? Are you trying to figure out the cause of it, or is it more effective to look at the solutions and the solutions that would be helpful for them in their current situation?
So as being a physician, that's why I'm different from every other clinic. You have to diagnose your patient.
Mm.
So you can't treat without diagnosing.
Hmm.
So you have to find out what is going on first. Because if you don't find out what's going on, you can't treat. Because every disease has a pathway to it. So the treatment is based on what you diagnose. Because you might have a scalp biopsy. If someone is dealing with hair loss for a long time, they might need a scalp biopsy, which is we take a sample of the scalp, the area of hair loss, and send it out, and they read it and see if the person has an inflammation going on. So if there's an inflammation, we have to treat that inflammation. If it's genetics, we treat the part that is causing the hair loss. So we have to diagnose first. So we have to have different ways we can diagnose hair loss. We have a dermatoscope. We have different things to do to diagnose causes of hair loss
Okay.
before we
And
treat.
yeah, okay. And so when it comes to the hair loss and the hair treatment, I'm thinking that, and I think most people think that, oh, it's just the hair on your head. Is that 100% or 99% of the situations, or do you get people that come in and they want hair restoration in other parts of their body also?
Say that again. Let me understand the question because I'm
Yeah,
thinking something else, but I wanted to explain for them.
yeah. So when it comes to hair loss, and getting a treatment to get the hair back, I think that most people would come in mostly for the hair on their head. But are there other situations, or is there a larger proportion of people that's looking for hair growth somewhere else? Like for men, are they trying to get hair growth around like their beard area or
Oh,
anywhere
yes.
else?
Oh, yeah, I understand your question now. So, having a hair restoration, we do scalp hair transplant, we
Hmm.
do eyebrow
Mm,
transplant, we do beards.
interesting. Okay.
We do, if you can look at behind me, you see different types of beards. I
Yeah.
don't know if you can see
Yeah.
right
Yeah.
now.
I guess.
So, we carve out the beards, we shape it out for you, we
Oh,
kind of constructed that. So,
interesting.
wherever you need hair, as long as you have hair, we can fix that.
Interesting. Okay. That's interesting because I think that most people just think about, oh, hair loss, it's on the head, but you don't think about the
No,
eyebrows, you don't
no.
think about the beard that much, but it
Some
makes
people
sense.
have patches on their beards that needs to be
Ah.
filled, so we can fill that in.
Oh, interesting.
See,
Okay.
some people burn patients,
Yeah.
we can do their eyebrows, reconstruct their eyebrows. So those are
Mm.
more fascinating burn patients,
Mm.
an unfortunate thing happened. So we're
Mm-hmm.
trying to actually give this person a second look at life,
Mm-hmm.
so that is a part of hair restoration people don't really know. People
Mm.
don't really understand.
Yeah.
See? So
Okay.
we do all kinds of things, scalp, brow, eyebrow, eyelashes too, you know,
Mm-hmm.
all that.
Okay. And you brought up another good point as far as like burn victims that come in and they want to grow their hair back. What other situations that you've seen that people would come in, like maybe not just the genetic or the environmental, but like I don't know about like accidents, or like I don't know if there's certain conditions, like medical conditions where you lose your hair, and can this help with, like, what are some of those other situations that people might lose hair in that they want to get it back? Like you mentioned burn victims, but like what other potential situations are there?
Oh, there's so many, like I said, there's so many causes of um hair loss.
Mm-hmm.
Now, if someone has had cancer, let's say, and had chemo,
Mm-hmm.
you can lose your hair and they want to grow it back.
Yeah.
So that's one part. If
Uh,
someone has had weight loss surgery, they can lose their hair and they will want it back.
mhm.
You see? So there are primary causes of hair loss, like the genetics, then there are secondary causes of hair loss. Okay, which is like trauma, accident. I've had a client that came in, was involved in a motor vehicle accident twice
Wow.
that caused her to lose her hair.
Mhm.
You see? So there are secondary causes of hair loss. That's
Mhm.
unfortunate situation. Then there are also hair loss due to inflammation that we call scarring alopecia. So I always liken your hair to a tree that has roots.
Mm.
Okay, so my duty is to make sure those roots are viable.
Mhm.
That because if you don't have roots, if your roots are dead, if you're not getting nutrients, what happens? The tree can't grow,
Yeah.
right? So that is my duty. That's why I say we diagnose. And that is why the most important thing is when you walk into my office, I need to make sure your roots are good.
Mm.
So
Okay.
that's why I look, that's my most important. If the roots are good, then we can figure out the treatment. But if there's a problem with the roots,
Mhm.
then I'll have to figure out what treatment can help revive those roots. Even if we don't revive it, we stop the progression
Mm. Mm.
of
Okay.
loss.
Okay. So you're really focusing on the roots then.
The roots, yes, that's
Got
very,
it.
very important, yes. Because if you don't focus on that, whatever treatment you might just be wasting your time. And that's why you see most people say, I've used this, I've used this, I've used it. But I always tell them, have you had a proper scalp evaluation?
Mm.
If you've not had a proper evaluation, you're just wasting your time because you can't use what every other person is using
Mhm.
because your hair and scalp is different.
Mhm.
Okay, scalp is a skin, so you have to make sure that you have proper evaluation. So that's it.
Okay. And when it comes to hair loss, I mean, there's lots of, I guess, solutions out there. There's the creams, there's supplements, there's like the laser helmets that you can wear and all that. What are your thoughts on all these different types of products out there? Like, are they effective? Are they only effective in certain situations? Like, is it worth the money, or like, should you just kind of skip it and go to a more serious solution?
I always say you need a proper scalp evaluation. Like I said,
Mm-hmm.
you can use anything on your scalp. And people
Mm-hmm.
say, this grew my hair. But if you use 1,000 things on your scalp, you actually don't know what grew your hair.
Mm-hmm.
So what I say is that I used to be like that. Whatever I see online, I buy it, I use it. I'm like,
Yeah.
okay, it's gonna help. But if you don't know what type of hair loss you're dealing with,
Mm-hmm.
so why are you using all that? You see what I'm saying?
Yeah.
So the laser cap is good. That
Mhm.
is good. That is the only treatment I was like, I'll give it a
Mm.
mark.
Okay.
But every other thing you're using, the serums, the oils, and all that, if you've
Mm.
not had a proper hair evaluation, it's not gonna work.
Okay. Okay. So you want to get evaluated first, figure out what the real issue is, and then from there you come
Yes,
up with a
and
treatment
that,
for the
yes,
issue.
that is the message. Proper
Okay.
scalp and hair evaluation, because no matter what you just keep wasting your money and your time.
Okay. That's really good to know then. Okay, instead of just trying to guess it and just take stabs
Yes.
in the dark, at least figure it out first.
And
Okay.
let me say something else. And I always tell people, I always liken hair loss as alopecia is a medical problem,
Mhm.
just like diabetes and high blood pressure. You cannot treat yourself.
Mm.
You need medication sometimes.
Mhm.
So the same thing with hair loss. You need the proper diagnosis,
Mhm.
then you need the proper medication.
Okay.
And the problem with hair loss is progressing. So if you're dealing with hair loss right now, the
Mhm.
right thing to do is proper diagnosis by evaluation.
Mhm.
Because if you don't do it right now, guess what? It's going to get progressively worse.
Mhm.
And once it gets worse, then the amount of time needed to revert it back, they're going to spend a lot of money trying to get it back.
Mm. Okay. And that kind of brings me to another point then. So while you're I guess in the early stages of hair loss, it's always best right now to try and get it taken care of. Because if you wait too long, then it's going to be even harder to try and get it back.
That's right.
Um,
Yes,
mhm.
especially men. I tell them that we have so many treatments. Like this machine behind me is
Mhm.
called a TED hair restoration. It's a machine, you don't need needles.
Mhm.
Nothing is a 20 minutes treatment.
Mhm.
This is something to maintain your hair. Like,
Mhm.
I tell people if you're in early stages of hair loss,
Mhm.
this is something that's going to work for you.
Mhm.
You come in, get 3 treatments once a month. Then after
Mhm.
that, you just need maintenance treatment. Even if you've had other treatments in the past,
Mhm.
one thing I've noticed is that people fail to, just like you come in and see a regular physician, primary care physician for your blood pressure, you need once a year or twice a year checking maintenance. You see? So it's the same thing with hair loss. So I want people to understand after the scalp evaluation, diagnosis, treatment, maintenance.
Okay. So once you get any treatment done, really at any level, you always need to maintain it, or you advise that they always need to maintain it moving forward. You can't just you're one and done and you're okay for the rest of your life.
Yes, maintenance can be in two ways. Okay. So if you've had a hair transplant, and most times we place you on medical therapy before hair transplant
Mhm.
and after hair transplant. So now the medical therapy can serve as maintaining
Mm.
your hair so that you don't have progressive hair loss.
Mhm.
So you see, with the hair transplant, you continue your medical treatment. You might not need to ever have any other thing. You might not need to come in for any other thing.
Okay.
You see what I'm saying?
Yeah.
So everything depends case by case.
Yeah.
So, but
Okay.
if you don't have a hair transplant and you've been on medical therapy for hair loss, you might need more treatment.
Okay.
So everything depends.
Yeah. Okay. And then that kind of leads me to my next question, which I think it's going to still fall under your answer if it's going to depend on the individual. But
Mhm.
when it comes to treatments, whether it's surgical or
Medical.
non-invasive or just topical, I'm assuming it's
Mhm.
always going to depend on the individual, what's going to be the best fit for them. For some people, surgical may be the best route. For others, it can be maybe more topical or non-invasive would be the better route.
Mhm.
Okay. And for any of these treatments, are any of them painful? I'm sure that you get that question from some people. Is any of these treatments painful?
Now, the TED hair restoration, this machine is not painful at all.
Okay.
At all.
Hmm.
So hair transplant is a surgical procedure. Every surgical procedure has some pain to it, but we numb you up. We apply numbing medication or inject local anesthetics, just to help with the pain.
Hmm.
But you'll feel something during hair transplant. But I guarantee you, after the hair transplant, you don't feel anything after that.
Hmm.
So there are so many, as long as it's going into your scalp,
Hmm.
scalp is a skin, you're going to feel something.
Hmm.
So I will also give you something to relax you for anxiety, for pain. So everything depends on the tolerance.
Hmm.
And
Okay.
so there's any treatment you want, something for now, first of all, me to say this first. Everything depends on your grade of hair loss or stage of hair loss. Number one, you might be advanced stage.
Hmm.
And once you come in, I take a look at your scalp. I'm like, the only thing that's gonna help you right now is hair transplant.
Hmm.
That's it.
Hmm.
You see? And now we can walk through the pain, the medication you need, and all that.
Hmm.
But I'm not going to suggest something else because of pain or not, and give you
Yeah.
some other treatment that's not going to help you.
Mm.
That's not right. Right.
Okay. Okay. Makes sense. Now, and I think this is also going to depend also on the treatment, but just so people have an understanding as far as time frame goes, like,
Yeah.
hey, if I do this treatment, when can I start seeing results? Or if I do this other treatment, how long before I start seeing results? So as far as expectation goes, what's the typical time frame that, depending on the treatment, that people will start to see the results?
4 to 6 months,
Okay.
full visual, improvement you will
Hmm.
see is 9 to 12 months.
9 to 12 months. Okay.
Yeah. So that's why it's important when we take pictures every time.
Mm.
When you come into the office, we
Hmm.
take pictures.
Hmm.
When you come back for your follow-up, we take pictures.
Hmm.
Because sometimes people are not able to see.
Mm.
But when I put the pictures side by side, I was like,
Hmm.
oh, this wasn't here.
Yeah.
This wasn't here. Like I had a client yesterday and I had to show her side by side when she came in the first time, 6 months after, 12 months after. She said, oh, wow. Oh, so that's why it's important we take pictures for you to see.
Okay.
Mhm.
And I'm starting to hear more and more about regenerative medicine coming into the field. So, what are your thoughts on regenerative medicine? Is it helpful? Do you think it's going to be the future, or is it just one other tool that you have in the tool belt?
Is one other tool that we have in the tool belt, one.
Mm.
And number two is that research is still going on.
Mm.
Research is still going on. Regenerative medicine has its place in hair
Mm.
loss, that's for sure. The same thing as functional medicine, lifestyle medicine has its place in hair loss. So, but regeneration also, everything is, like I said, based on individual.
Mm.
So I don't want you to, I don't want them to sell you regeneration
Mm.
without a proper scalp evaluation by a medical doctor.
Mm.
That's number one, because anybody can offer it, but are
Mm.
they actually looking at your scalp to make sure there's no inflammation, to make sure you don't have an infection that needs antibiotics, that needs something? Okay, so
Mm.
before you go for any treatment, make sure that somebody takes a look at your scalp.
Mm.
They're not just taking a look at your scalp, they're diagnosing what is going on.
Okay.
So don't go to someone that's going to tell you, oh, this might be this might be this. No, that's not what you need. You need, hey, what is going on? So that's why a medical doctor is advised to go to a dermatologist or your primary care doctor or a hair transplant physician. Those people can get a scalp biopsy, they can order blood tests, they can give you an answer.
Mhm.
Then, if you decide to go to regenerative medicine or
Mhm.
regeneration, then that's okay. But like I said, I've not seen a treatment that's like hair transplant that is one and done.
Mhm.
Like, why hair transplant is very powerful is that it's almost like you're an artist. You are recreating something that was lost.
Mhm.
You see, haven't seen any treatment any hair loss treatment that you do one time and that's it.
Mhm.
With hair transplants, imagine someone walking into the office because hair transplant is more advanced right now. That someone doesn't have a hairline. We recreate that hairline. We look at you. We kind of take you back 10 years. We move your age backwards. Like that's why you see they look younger.
Yeah.
Every time you look at a celebrity or something, you say there's
Mhm.
something different about this person.
Mhm.
Probably they've had a hair transplant.
Mm.
You see, because
Yeah.
they move their hairline forward a little bit and they look
Ah,
younger.
okay.
So you see, most people
Yeah.
have had a hair transplant, but they won't tell you. But there's something different about this person.
Yeah.
You see, so that's why a hair transplant. So there's no other treatment about hair loss that can give you the the kind of feeling, the confidence that comes with
Mhm.
hair transplant. That's why I'm an advocate for hair transplant.
Mhm.
Like I said, it's better for you to start early if you're dealing with hair loss than you to wait till you're advanced.
Mm.
So
Mhm.
that's the issue. So regenerative medicine or regeneration is okay,
Mhm.
but you need a proper evaluation. That's my point.
Got it. Okay. Now, Dr. Echefu, what would you say are some common misconceptions or myths that you hear most commonly from your clients and your patients about these types of treatments or just hair loss in general?
They always say, I didn't know I could have a hair transplant. Females could have a hair transplant. Like I have a lot of that. A
Mm-hmm.
lot of my female clients, when they come in, because hair transplant, they always think hair transplant, more men do
Mm.
hair transplant. That's what they think. And number two, they always think that they have to shave their whole hair.
Mm.
And women, we are not open to that. We want
Yeah.
to still look good. So
Yeah.
I'm like, no, hair transplant now. We don't have to shave your hair. We can actually, that's what we call the long hair transplant. We don't have to shave anything. We actually move your hair. move it around, and filling the gaps where you need it.
Mm.
So that's the misconception. That's for especially for females. Then number two is that they always feel like hair transplant is gonna look so unnatural.
Hmm.
I'm like, hair transplant is so advanced. The problem we get when you run into problems with hair transplant is when you go to unlicensed clinics,
Mm.
you know, and when you travel to places that don't have a doctor doing the hair transplant. Because a hair transplant is more calculation, is a calculated recreation of your hair.
Mm.
Because we have to calculate the area of hair loss. Then we calculate the amount of hair we need to fill in that area. So imagine if you're now going to a place and they're promising you, we're going to give you 4,000 grafts, we're going to give you 6,000 grafts. I promise you, they are not giving you that amount of graft.
Mm.
They are not. They are
Mm.
lying to you.
Mm.
Because we've had problems, and that's why I'm involved heavily in ISHRS, which is an organization for hair transplant physicians or surgeons, and I'm an advocate, you see.
Mm.
So we're heavily into that because it's a problem. Because the problem is once you have the complication, they now seek the real hair transplant surgeons to fix the problem.
Mm.
So we run into those problem clients come in and say, hey, the clinic is closed. I can't get in touch with the hair transplant surgeon. I
Mm.
can't get in touch with the clinic.
Mm.
So, then you're not charged more to fix the problem.
Mm.
You see, or
Yeah.
sometimes most hair transplant surgeons won't even touch the hair because it now becomes a liability for them.
Mm. Wow.
So that's the problem. So that's and the other one I want to say is that people think it's very expensive.
Mm.
So hair transplant is expensive. Every cosmetic procedure is expensive. But now I always offer something in my clinic. We call it staged hair transplant. What is staged hair transplant? Now someone can come in and they have a large area of hair loss now that
Mm.
needs to be filled in with hair transplant. Now I'm going to tell you, I'm going to look at you and like, which area is the area that's bothering you the most?
Mm.
Then they'll tell me, hey, I think my hairline, I think my mid scalp, I think my crown area is what's bothering me the most. But
Mm.
now, as a hair transplant physician, I'm going to look at you and tell you, hey, I think your front hairline is where we need to focus on right now. So
Mm.
we can start here right now. So I can fix right here while your medical therapy. Sometimes I can fix only the hairline and the mid scalp and
Mm.
place them on medical therapy, and they'll be happy with their results.
Mm.
So you don't have to go and cover everything at the same time. So
Mm.
that's why I call it staged hair transplant. We can just do it in small sessions.
I see. Okay. That's very helpful to know.
Yeah.
So I guess this kind of leads me to my next question then of let's say someone is looking for help with hair loss. They don't know, like I think we kind of dove down deep into make sure you get the consultation done, have them take a look at your scalp and do the evaluation. But if someone's looking for a doctor, a provider, somebody who can help them with this, what would you advise them to look for when they're looking for that right person who's going to be able to help them, has the knowledge, has the expertise, and can really give them that right path forward?
Okay, so everything basically, everyone has a trichologist, a hair loss, a dermatologist close to them,
Mm-hmm.
your primary care doctor. So what I say, start with your primary care physician.
Mm-hmm.
They can order blood tests. They can check if you're anemic. They can check your iron levels. They can check your vitamin D. They can check the basic things that you need, and they can take a look at your scalp, what you need. You see? And if they need to refer you to a dermatologist, they will refer you to a dermatologist. Now, if you can get a hold of a dermatologist, you can get into a dermatologist's office and they'll take a look at your scalp. You see? So those are the basic steps. Then the dermatologist, if they don't offer hair transplant or other treatments for hair loss, they will refer you to a hair transplant surgeon that offers surgical and non-surgical, procedures in their office. So the first step is just start with your primary care doctor if you want a diagnosis of your hair loss. But if you just want someone to also look at your scalp, you can look for a trichologist, which is also someone that is a hair loss practitioner. They don't diagnose hair loss, but they can take a look at your scalp and give you suggestions on what to do.
Okay. Okay, that's a great place to start then for people. Now, Dr. Echefu, I'm sure that over your career you've seen some tough cases, or I'm sure there's some memorable cases that really come to mind. Is there maybe one story that you can think of that you wouldn't mind sharing of just a tough case, a challenging case, a memorable case, and how you were able to get them a great outcome in the end?
So when people ask me these questions, I always say that every case is unique,
Mm.
you know?
Mhm.
And if you want to know more about my cases for your audience watching, my Instagram page is Havila Hair Restoration. My YouTube name is Dr. Echefu. I interview my clients, they talk about the experience. So I'm not going to kind of dispel other of my clients, but the most important ones, what makes me really happy with my clients is that some of the women, they say, you are the sister that I needed. You see, some
Yeah.
of them say, where have you been all my life? You see, some of
Yeah.
them look at their before and after picture and say, wow, I look so different. So I
Mm.
had a client, personal friend of mine, had a hair transplant. She's never had a front hairline. She said all the time she's known herself as a grown adult, she's
Mm.
always worn wigs. See,
Mhm.
then I did a hair transplant. You see, and I talk about the staged hair transplant. We
Mhm.
just did a little bit, just the front hairline,
Yeah.
just to see. And she's never worn her natural, when I mean never worn her natural hair outside.
Mm.
And she comes to my office, her hair, 6 months after that, we pulled her hair in a bun and she walked out with it.
Wow.
Like, what other satisfaction do you want?
Yeah.
You see what I'm saying? So
Yeah.
it's the stories of before and after
Yeah.
that gets to me.
Mhm.
So everybody's story is unique.
Mhm.
Or, some people, there's something also do scalp micropigmentation. Scalp micropigmentation is tattooing of the scalp. It's
Mhm.
almost like tattoo, they're depositing ink into the scalp. It shades, some people's problem sometimes is that once they walk into a room and there's light, it
Mhm.
hits on their scalp and the scalp is shining and they don't like it.
Mhm.
So I've had a client, she came in, she's like, Doc, it's not really about the hair loss I'm worried about. I'm worried about my scalp is so shiny. I'll have to use all those dyes on my hair. I'm tired
Mhm.
of doing that. Is there a solution for me? I'm like, say no more. So I had to do the scalp micropigmentation. We did 4 sessions. And she no longer wears, her hairstylist is like, whatever she's doing to your hair,
Mhm.
is fantastic. Keep doing it. She's like, Doc, I no longer have to put all those powders, black
Yeah.
dyes on my hair, those powders. I no longer have to, I'm no longer, I'm no longer feeling a certain way. I'm like more confident. I don't
Mhm.
even care anymore. See?
Wow.
So that's the power of hair restoration. That's the power. Your confidence level is different. I tell people, once you walk into a room, that's the first thing people notice, your hair.
Yeah. Yeah.
See?
That's a
So
wonderful story.
people notice that. So for
Yeah.
you to hear these stories about, about what has changed in their life because
Mhm.
of hair restoration, I mean, is mind blowing. I mean, I'm a testament to what my hair growing, so I can relate to their struggles and stories.
Mhm. Now, where do you think the future of hair treatment, hair restoration, hair loss, like where do you think the future is going with that?
The future is going, and I think more people need to be aware of possible treatments, and
Mhm.
I need people to be aware of hair transplant. Now, hair transplant is more advanced that you don't need to shave your hair. You can walk in and walk out same day. Nobody will know that you just had a hair transplant. So we call it your
Oh, wow.
unshaven hair transplant.
Mhm.
Most celebrities get it that you don't even know.
Huh.
You
Wow.
see,
Yeah.
so that's the awareness right now that is more advanced than you ever think of, that you've ever thought of. So you can basically, if you're dealing with hair loss, I don't want you to suffer. There's some things also we offer in my clinic. I don't think you're going to hear it any other. We offer mommy makeover hair
Mhm.
transplants.
Hmm.
If you're a busy mom like me,
Mhm.
you've had your kids, and you're dealing with hair loss, because like I told you, there's so many causes of hair loss, which can be
Mhm.
stress. And everybody has an atom of stress going on in
Mhm.
their life, but it depends on the degree. So that can also cause you to have hair shedding, okay? Making hair loss more pronounced. If you're dealing with hair loss or eyebrow loss as a mom, we have mommy makeover. We help you fix your hairline and your brows at the
Mhm.
same time, give you a new outlook on life. So that's something you won't see anywhere. And this is what I come up with plans to help my clients, give them different ways on how to look good when it comes to their hair.
Wow. Okay. That's amazing.
Mhm.
So, Dr. Echifu, I have one last question for you, but before I ask it, I do want to point people to your website at hh-restorations.com. Now, last question for you is what does beauty mean to you?
Oh Lord. I'm very fashionable. You can see I'm very, very passionate. But I also told you the story about working in the ER. And one thing people know me for is that I've never gone to work without my makeup. Never in
Mm,
my 14 years of being a physician.
mhm,
I've never gone to work without my hair done, without my makeup done. I've never done that. So beauty is very important, and beauty starts with your hair.
mm,
It starts with your hair. Like I said, when you walk into a room, that's the first thing. You might not have makeup and people will not realize that. But once your hair is undone or once your hair looks funny, people are going to see it. That's one thing I tell people. So hair is an important part of our daily existence. So if you're dealing with hair loss, I mean, taking care of your hair is part of self-care, it's part of
mm,
self-love. And I preach that on my YouTube channel. Like I really talk about hair loss, hair transplant on my YouTube channel. I talk about what other hair transplant clinics won't even tell you, like the secrets about hair transplant, what
mhm,
you can do, the little tricks and tips.
mhm.
This is all just to help someone realize that it's not that bad. I can do it. Like, I can take care of myself, and this is what I need to do to take care of myself. So
Mhm.
I think beauty is basically self-love and self-care.
Great answer.
Mm.
Well, there you have it. Dr. AJ Fu sharing her expertise. So, Doctor, where can people contact you in your practice?
So now our website, you already said our website, ha-restoration.com. You can actually type me in Dr. Echefu. I'm sure you're going to see me online. I've been on so many podcasts,
Mhm,
everything, so they can find me. Then there's something I didn't talk about. We offer free virtual consultation.
mhm. Okay.
Free. Like, I tell people it doesn't take much.
Yeah.
Contact us. We
Mhm,
can go online and just, schedule an appointment. Like it's free. Somebody
mhm,
from my team will get in touch with the person.
mhm,
We give you tips. We send you an email tips on
mhm,
what to do while you're dealing with hair loss, what to do. If you need further evaluation, you come into the clinic
mhm,
and we talk to you. Even if you're out of state, out of the country,
mhm,
we do free virtual consult. Just someone from my team talking to you, taking information that is needed. If you've
mhm,
seen someone in the past, if you haven't seen someone, these are like, simple things we need to know.
mhm.
Then if you need a hair transplant, then we go from there. So I think that's one part that people forget that, I can really be seen by someone. You don't need to come to the clinic.
That's awesome. That's good
Yeah.
to know. Okay.
Mhm.
Well, Dr. AJ Fu, this is awesome. Thank you for shedding so much light on this topic. I think a lot of people struggle with it. And just thanks
Yes.
for sharing your message.
Thank you so much. Thank you so much. Okay.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.